Uganda has recorded a 20% reduction in the spread of Mpox, an infection that continues to worry scientists across the African region. The first cases were reported in July 2024 at Bwera Hospital in Kasese district, traced to an outbreak in the Democratic Republic of Congo that began in September 2023. A new epidemiology report by the Africa Centers for Disease Control and Prevention, Africa CDC, now places Uganda out of the countries of concern, citing a general decline in new infections across the continent.
There is a continuous decrease in the number of suspected cases from 2,264 to 1,936, but also by the confirmed case almost by 50% from 603 to 328. But we are glad to see that the cases are declining in terms of average by 78%, but also that you keep on seeing the improvement, especially testing coverage, which is more and more reassuring on the surveillance, but also on the opportunity to use the Mpox as a way to strengthen the health system. Because when the testing coverage is increasing, it's also an evidence that the laboratory are getting closer to the community and that the capacity to bring the sample from the community to the lab is also improving.
Uganda's outbreak was officially declared by the Ministry of Health on August 2nd, 2024. Since then, the country has registered over 6,000 confirmed cases and more than 50 deaths. According to the Africa CDC, improved coordination and response efforts across the region have played a key role in containing the disease. The organization is urging African governments to expand vaccination coverage as a long-term strategy to control Mpox.
We have estimated at IMST that we might need 6.4 million doses of vaccine to ensure that we protect, we respond, we control the outbreak in the most of our affected member states. So far, we've managed to mobilize 6 million. 5 million doses have already been shipped to countries. So it is a bit particular. It's a large country. They've also, through the support of the Japanese government, to have 3 million doses that are in country, the LC16, while the other country has been benefiting from the MVAPN. So far, the countries that are really facing challenges have received dose of vaccine. Now, as I mentioned, the 3 countries that are of most concern as we do speak right now is Liberia, is Kenya, is Ghana, but also Guinea. Though the cases have a bit decreased, they were also increasing. And those ones have been supported by shipment of 20 to 30,000 doses of vaccine that they recently received. And those ones will be actually starting the vaccine soon. This is Guinea, but also Kenya has already used 10,000, and they will be receiving 20,000 so that they can boost the vaccination, especially in Nairobi, that is also now affected. But we are also looking at it on the side of the transition that you've mentioned. In the transition is the integration of vaccination into the API. So we see 2 categories of countries. We have countries where we are dealing only with, let's say, only with the outbreak, and we have those countries where that are endemic. So for those countries, we need to have the right estimate, which will move around 3 to 5 million of those of vaccine needed. So that what happened in the past for the smallpox, where we had those vaccinations to ensure that we eradicate smallpox, should also at some point happen for Mpox. So if we achieve that, we'll do 2 things. 1, we'll protect our people, but 2, we also accelerate the local manufacturing. Because to make sure that we have the local manufacturing in the continent, we need to have that demand, which is there.
However, experts warn that the progress made does not mean the fight is over.
We definitely needed a new model of responding to those outbreaks in the continent. And the incident management support team, this is co-led by Africa CDC and WHO, with all the different partners around, is definitely the model where we can see the efficiency, especially at the time where we have to do more with less. And this coordinated approach has significantly allowed us, 1, to mobilize the fund to respond, 2, also to mobilize the 6 million doses of vaccine, but also to ensure that we were moving as one team behind one plan with one budget and one M&E framework.
Members of the public are advised to remain vigilant and look out for symptoms such as skin rashes, fever, headache, muscle pain, and general body weakness, and seek immediate medical attention from a qualified health professional. Walter Mwesigye, NTV.